Okay, so we have a shoulder injury here, and what we're going to do here is we're going to take a look at one non-injured shoulder and one injured shoulder to illustrate the thumb up the back pattern, okay? Super valuable. So on Christine here, what I'm going to do is I'm going to take the good shoulder and I'm going to show you guys what a healthy shoulder looks like. And in this case here, you can see that the shoulder blade is visible. It's popping up nicely. The elbow is dropping nicely. And this is our basis for our starting point here of what the healthy shoulder appears like, okay? And no pain. On this one, as I place the thumb and the hand up the back, the shoulder blade is being trapped. The shoulder blade won't lift, okay? So look for this. Look to see. And also the elbow. Now, if I come up higher with the hand and I place a greater amount of torque into that joint line, it's going to hurt and the elbow is going to hang up, not foolishly. So I'll back away and I'll try to find the location of the hand. So what I'll do is, as I back the hand away, all the way back down by the buttock here, look at that. Suddenly I found a place where the torque on that humeral bone, it wasn't so extreme, and the arm was comfortable enough to be able to fall to the ground. So I'll bring it back up again and you'll see, look at that. So as soon as I hit that point of torque where the injury is picked on too much, the elbow will rise up just as you see right there, and the front of that shoulder is going to hurt. So in the event that the thumb up the back position is the most painful position for your shoulder, you're in the right place. Of all the things that I've learned about treating shoulders, this one's probably the most exciting because this is the one that's fixed more shoulders than anything else I've ever done in this office. So, 25, 30 years of doing these shoulders, I'd love to show you this one. So that thumb up the back procedure there and position requires 3 motions, and we talked about this a little bit earlier. Now, one of them is internal rotation. The other one is extension, arms coming back behind it. Okay, and the third one is adduction, or the arm would be cutting across the plane of the body. So oftentimes in a severe situation, you want to take these 3 motions and you want to work them separately. So I can start off with extension, the simplest, and start to work the shoulder straight backward. And on this one here, oftentimes I'll cup the shoulder with one of my hands and I'll gently lift the hand backward. And my goal would be to get this, and sometimes you guys are going to feel that the shoulder doesn't want to go any further than this. You make a note, okay, my arm goes back 20 or 30 degrees. 90 is normal. And so in normal range, your shoulder will be here. This one here, I will work by palpating the front of the shoulder, holding it, stabilizing it, and gently stretching it back behind me, all the while I'm doing some massage around that shoulder cap, okay? The second one we're gonna do is adduction. So I'll take the arm and I'll bring it across the plane of the body. And then, Kristen, I want you to push the arm back sideways and relax. And push again and relax. And you do a little contract, relax on that. It's going to fire the deltoid muscle. It's going to fire some of the rotator cuff muscles. And after those contractions are done, the shoulder joint will be slightly more amenable to the stretch. The third one, of course, and the most important of the 3, is to place the arm with the thumb up the back in the position that you did to test the shoulder. And this is a therapeutic position and an assessment position, and you're going to wait. Now, the real magic formula comes in here. I've got one hand that's going to be holding that humeral head in the middle of that joint line, because as you put a thumb up the back and you stress it, and the humeral bone doesn't want to turn inward, you're going to have to stabilize it and help it a little bit. So my fingers will feed that humeral bone inward a little bit. And with my other hand, I'll do a gentle compression downward of the elbow joint. So I'm going to turn that humeral bone in as I push down. Now gently lift the elbow up and relax. And this is going to hurt a lot. This one by far is the most tender of the 3 different positions, but still probably the most valuable as well. And what we're going to do is we're going to use a contract relax technique on this one. Contracting the muscles is when Christine lifts the elbow, and the relax is when she lets it go. And then I go and I try to get a little bit more range out of it, all the while stabilizing with my opposite hand here. So go ahead, lift and relax. And I wait to feel with my other hand, the hand that's covering the cap of the shoulder. I wait to feel that relaxation effect, and then I can slowly push the elbow down to get a little more range out of it. Now this technique is going to be used, you're probably going to be doing this for about 10 or 15 minutes each time that you treat your shoulder. Now keep in mind, you cannot unwind these shoulder injuries in a single treatment or a single session when you're working on yourself or having somebody help you with this, okay? I would say the longest period of time you want to treat this is going to be 20 to 30 minutes if you wanted to just take it nice and slow, or maybe 15 if you wanted to try to save some time. But the shoulder can't handle being torqued into these painful positions for a long period of time, and you're only going to set yourself back. So the idea here is to work with the tissues, okay? Working with the tissues means I wait till the body is actually starting to do the thing that it doesn't want to do. So when you first start applying these therapies, they're going to hurt a lot. That's okay. You can back away. You can give it relief, and you find a position where you're no longer in pain, and then you revisit the position that you're in pain. And each time you're trying to make these positions feel easier, less painful, and greater range of motion. So you're looking at maybe putting the hand up the back, trying these contract relax techniques about 10 to 15 times, taking a break. And overall, the treatment session is going to be roughly 15 to 30 minutes each time you do this. Give it about 2 to 3 days of rest and come back and try it again. I think what you guys are going to find is that each time you revisit this, the shoulder is going to feel more and more relaxed and more comfortable, and the injury is going to go away.